Hello, my name is Sarah Coleman. I'm going to talk about endometriosis and the lack of education that nursing schools have for the disease. So, the reason why endometriosis is a kryptonite for me is because I have spent majority of my childbearing age, lifehood, with endometriosis. But aside from that, the disease is not easily diagnosed. There's actually only one real definitive way to diagnose endometriosis, which is through surgery, which they collect the sample tissue and then they test the sample tissue. One issue that I've seen with the disease process is the lack of knowledge that the nurses have, and I've seen nurse practitioners that lack the knowledge as well. Particularly my primary care physician, which I will talk a little bit later about. But I've also noticed that in nursing school, there was a little, I call it a blur, but it was a paragraph, and it didn't teach you a whole lot of the disease at all, really. It just told you what it was and, that it was painful, and that was about it. So how are we to know how to assess this or educate our residents or patients, or provide interventions that apply to the actual disease it's on? And I realize we cannot go into every single detail about every disease process, or else our books will go on for pages and pages and on and on. But at least half a page or even half a page with a chart would suffice. We were not taught enough on what we needed to know about patients with endometriosis. According to the Future of Nursing 2023, nursing school curricula need to be strengthened so that nurses are prepared to help promote health equity, reduce health disparities, and improve the health and well-being of everyone. So, according to Kleiman and others, the World Health Organization estimates about 10% of girls and women are affected by endometriosis worldwide, which equates to approximately 190 million people. That is found from 2022. So, essentially what you're looking at is for every 10 women in a room, there will at least be one that has endometriosis. Still think that this disease needs only a small paragraph? Also, according to Kleiman and others, endometriosis is a chronic condition in which tissue, similar to the endometrium or uterine lining, grows outside the uterus. This tissue can grow as far up as the diaphragm, which could cause breathing problems, chest pain, arm pain. It almost mimics a heart attack. Majority of the pain will be more intense during a woman's menstrual cycle. Depending on where the tissue growth is, determines the symptoms a woman might have. Because of the pain, it can cause emotional issues. According to psychiatry.org, endometriosis is also associated with mental health conditions, including depression and anxiety, and a reduced quality of life. And that is from psychiatry.org 2022. Symptoms that clinicians usually suspect are more likely to diagnose a disease in females presenting with the typical symptomology, such as dyspareunia, namely painful sexual intercourse, pelvic pain during menstruation, dysmenorrhea, or painful urination, which is also called dysuria, or defecation, or infertility. The pain is usually characterized as chronic, cyclic, or progressive, and it exacerbates over time. This is according to Tadi and Mahdi of 2023. The assessments that the nurses should perform include the history and physical. It's important in helping diagnose a patient with endometriosis. According to Tazamati and Mahadi 2023, the disease diagnosis is usually delayed an average of 4 to 11 years from the onset of symptoms. That is a long time to go through not knowing what is going on with you. So as nurses, we do not diagnose the patient, but obtaining a good history and physical will help the providers diagnose the patients. The history can consist of the symptoms that we talked about earlier: dysmenorrhea, painful sex, painful urination and defecation. Pain can be located in the pelvic, but reach to the back and the flank areas and all the way up to the diaphragm. So according to Tizamonti and Mahadi of 2023, the treatment of endometriosis is broadly categorized into two main categories: pharmacological and surgical. There are several medications that may help that are not just related to pain medications. These are known as hormones, or they're also considered the first line of pharmacological therapy proposed for the management of endometriosis. Consist of NSAIDs, progesterones, or combined hormonal contraceptives, according to Tasmonti and Mahadi in 2023. As with any medication for hormones, there can be unwanted side effects such as emotional upsets, weight gain, skin issues, just to name a few. So we should warn our patients of these side effects. According to Tazamonti and Mahadi, the major advantage of surgical treatment compared to pharmaceutical options is the ability to enhance fertility capability, but it also provides pain relief simultaneously. So surgery can help it, but it does not fix it. So of course, the nursing interventions need to be aimed at controlling the pain and alleviating some of the emotional symptoms, reminding the patients that the concerns are valid. It's not just because you can see something on imaging does not mean that it doesn't exist. So if it's not there, some doctors say that there's nothing wrong with them. That can also put an emotional strain on your patient as well. So we want to educate our patients on the disease process. In order to do that, we need to know about the disease process itself. And that's why it should be taught in nursing schools, and all nurses should be reminded that because of the long, lengthy process of being diagnosed, patients will have doubts about whether or not their pain is real. As nurses, we should advocate for our patients and be the voice they are lacking in. And again, 10% of women have endometriosis. The nursing force should be properly educated on a process that is prevalent in our community. Thank you.